Good afternoon. Thank you for coming, and we welcome you. We want to talk about the Inflation Reform Act. And my name is Mary Siver, and this is Lindsay Marsteller. We're with Insurance Services of Zelienople. So we're close by and can answer questions for you. Today is general information, and at the end, if you would like to schedule an appointment, you can call us to do that, or we can schedule it today to review your personal insurance information. But it needs to be a personal meeting, not just in a setting like this. So we're going to go over this presentation, the Inflation Reduction Act. And this is just an overview on the first page of the IRA changes, meaning Inflation Reduction Act, not individual retirement account. It's Inflation Reduction Act.
Hold her up, the microphone.
Okay. And there's important changes that will be arriving to Medicare benefits for 2025 thanks to the Inflation Reduction Act. These affect most Medicare enrollees with prescription drug coverage. Why these changes happened and why they are and how they may affect you, and next steps so that you're ready.
Oh no, it's stapled very oddly. It kind of goes like flip book. I couldn't get along with the printer.
The Inflation Reduction Act of 2022, President Biden signed the Inflation Reduction Act into law on August 16, 2022. It was passed in 2022 and was designed to help meet climate goals as well as to benefit many vulnerable populations, including Medicare beneficiaries. The goal for Medicare was to improve in several ways, including lowering drug costs, expanding benefits, and stabilizing prescription drug plan premiums. Then I'll flip over to this page.
Do I go over this one?
We need to get numbers on these.
Yeah.
But
So it looks like this.
okay.
So it has.
And
Here you say what it says.
So it says IRA updates affecting prescription drug coverage, Part D. That's what the title is on that page. The Part D prescription drug coverage update started in 2023 with a $35 cap on monthly insulin copays and will create further consumer savings in 2025 that continue into 2026 and beyond. Here are the three main ways changes will happen. The Part D benefit redesign. This updates Part D cost sharing for members. Created an insulin company, CAP, in 2023 and expands eligibility for LIS, and that is low income subsidies. So there's different levels of help available in Medicare. And the subsidies can be up to 150% of the federal poverty line. Drug price negotiation. The federal Medicare program will work to lower prices for drugs with high consumer costs. And the drug price inflation limit, that limits the Medicare drug price increase to the level of inflation. Okay, and you want to talk about the costs?
Yeah.
Okay.
So what does this mean for you? Can everybody hear me okay? Okay. So what's changing to your prescription drug plans? That's what we're here to talk about today. I know some people had asked when we were passing out the presentations who we represent. So we work for Insurance Services of Zelienople. We represent most of the major carriers in the area. So we represent Highmark, Blue Cross Blue Shield, UPMC for Life, Aetna, Humana, Cigna, United Healthcare, did I say that? So there's
Yes.
a few plans. So we're very familiar with all of the plans, and there have been a lot of changes to them. So we're not going over all of those, because I'm sure everybody in here has a different plan, but this is affecting everybody's plan, no matter which one you have. So what happens in 2025 with what Mary just spoke about is who's paying for the drugs and what you're paying for your prescriptions is going to change. So in 2025, drug manufacturers are going to pay more for those prescriptions. The Part D plans also have to pay for more of those prescriptions, and your cost as the member decreases due to this Inflation Reduction Act. So how does that work? So this presentation, I don't like how they stapled it.
I know.
So the one thing we put on our flyer was there is no donut hole. So for years and years, we've been hearing there's going to be a donut hole elimination. That's not going to, this year, 2025, it's gone. There's no donut hole. So the maximum annual out-of-pocket cost is capped at $2,000. The top of this page says additional Part D changes for 2025. This explains how the drug coverage stages works now going forward. So there's a maximum out-of-pocket cost for your prescriptions of $2,000. So after you reach a deductible, if you have one on your plan, you pay 25% cost sharing, but after you reach $2,000, you're in the catastrophic phase. So there's no more donut hole. So it's just the initial coverage stage, the deductible, the initial coverage stage, and catastrophic once you hit that 2,000. There's also a program they came out with that's called the Prescription Payment Program. I think that's it. We're still
3P.
M3P. So you may have been getting phone calls from your current carrier. If they think that you're eligible for this program, they are reaching out to members. So it's from your carrier. It's not going to be from an agent, a broker. I mean, that's what we do, but the companies themselves are reaching out if they feel that they have clients that could use this program. So what it is it's called a smoothing program. It's helping you smooth out your costs to help you with your budget. So when you go to the pharmacy, if you have, for example, your drug costs $600 or more, they might suggest you sign up for this program, and it spreads out your payments monthly. So there's an example on this page that says you have a prescription that costs $300 every 3 months. You now have the option to pay $100 per month. But it's spread out, it's smoothed out over the whole entire year. So that's a new option, and that is going to be billed from your provider, not the pharmacist. So what does that mean for you and the plans that you have now? This is affecting the Medicare Advantage plans and the prescription drug plans. The benefits have changed in all of the plans to accommodate these changes. If you've gotten your annual notice of change letter, they should have gone out by the end of September. They'll outline your current plan and what changed for next year in your plan. A lot of the changes are going to be a premium change, updated co-pays, and different tiers of drugs. This is going to be the biggest difference with all of the plans, is how your formulary works, how your drugs are going to be tiered, and the cost sharing on those drugs. So we can't get into benefit specifics because it's an educational discussion. That's why it's nice to meet one-on-one, because it's very important this year to go over what your plan currently, your coverage is, and what it looks like for next year, because it's going to be very different. So there's also going to be drugs that are changing tiers and also being removed from the plans for them to accommodate these changes. So you want to evaluate your plan to make sure it still is the best plan for you, but really check your prescriptions. And we are here, that's what we're here for. Introduce ourselves, let you know we're here to help you. It's a lot to go through. We're still learning about it every day. So, reach out to us as your resource. We have programs where you can apply for extra help with your prescriptions. We can type in 20 medications and it pops out this plan, this plan, this plan, this plan, what your costs would be, because it is going to be very different. And it is a little overwhelming, and we want to be here to help. But that's going to be the big changes. You're going to see the benefits are going to change, the premiums are going to change,
The tiers.
The tiers of the prescriptions are going to change. Now, as far as like what the doctors and plans, you obviously want to always make sure your doctors are still covered and make sure the plan is best for you. You know, the person sitting next to you might have one plan because it's the best for them. The other one might have something different. So that's what we're here to do and help. We like to give these big presentations to get the generic information out to you. But since we are so close, I think one-on-one is better because everybody has a different situation and you really want to evaluate the plans this year because of all those changes. This summary from that is basically kind of what I went over. There's no donut hole. So once some of the plans have introduced a deductible on their prescription part of their plan. So you want to check to see how that has changed on your plan. The cap is $2,000. We won't get too much into how that works because that's not necessarily meaning that you'll spend $2,000 out of your pocket. It's very individual to the plan, but that is the cap. So you won't spend anything more than $2,000. So removing the donut hole, the insulins are still, that was part of it that happened last year, was the insulins are capped at $35. And then the smoothing of the prescription drug cost over the year. So that comes from, like I said, the plan that you are participating in. So if you have gotten your annual notice of change, I would take a look at them or reach out to us, see if there's something that you have questions about. If you don't understand, does your plan have a deductible now? What's covered, what's not covered, how the drugs are going to be covered? Definitely reach out to us. We're here to help.
What's the maximum deductible? 500 and
I think the maximum deductible is
525, I think.
I think it's $525. So it's not on all of the plans, but some of them did a half deductible, some of them did no deductible, some of them increased the premium. There's just been a lot of changes, and then I know a lot of members of this community have a supplement plan along with a prescription drug plan, and the prescription drug plans, in my opinion, I think are the ones that really took a hit from this, but the Medicare Advantage had to make up for some differences for this too as well. Does anybody have any questions, concerns? I know it's a very generic presentation, but it made a lot of changes throughout the year.
It's very the changes are very plan specific. So that's why we had to keep this meeting very generic, but we wanted you to be aware that there are changes on the drug coverage, quite a bit, actually. So we can look at your individual plans and maybe help you out to know if you have a deductible. Some of them apply from starting with generics. A lot of them exclude generics, but again, a review is very worthwhile.
And I think some of the plans too have eliminated some of the silver sneakers benefit. I can at least say that.
Right.
But other than that, we can't get too much into detail, but.
On this million of the payment, like if you have a $300 prescription that you get every month, you debit that you pay $100 monthly.
There is no interest on that.
There is no interest. Her question was if.
You think they might charge advancers at the end. I mean, after they see what happens the first year or whatever, how it works.
So her question was if there's an interest on the payment for the prescription once it's smoothed over. So they can't add interest and it's considered medical debt, so they can't go into collections. But what they can do is if you've missed so many payments and every plan is different, then they can take you off of the payment plan. They can't disenroll you from your medical plan.
Mm-hmm.
Yeah. So it's all going to be, it's going to be administered through your plan. The pharmacists, we've been told, have just been informed about this. So it's going to be an administrative nightmare
For them.
So, yeah, if you get those phone calls, though, from your provider, that's because they think that you may benefit from it. It's not going to benefit everybody. It's going to benefit if you have really high-cost prescriptions, because it's going to, if you get a prescription this month, you spread that out, and then you get another prescription, you spread that out. You're almost like adding to your total than just paying the copay. So that's where they're
And
thinking.
it's due by December. It needs to be paid in full.
It needs to be paid in full by December of the fall, like 2025.
So,
If you do the prescription payment plan,
And what happens if we can't? Ain't it saying,
they'll take you out of it.
they just take you off of the plan.
say it's not new insurance?
No, they take you off the payment plan, not the medical plan.
They nobody then looking for that bill.
There is,
We don't know yet.
that's, yeah, that's a better answer. We don't know. I mean, they haven't really been able to,
Eight, have everybody think, oh, I can just work at pain and then we talk to separate the $2,000 that pay in December.
You are correct, and it really behooves you to review that with somebody because it's not beneficial in all cases. It just depends. I mean, maybe somebody said, oh, I have a CD that's maturing in 6 months, and then I can pay this all off. It's a very individual thing, and it's a dollar amount also, but the thinking is, Medicare runs on a calendar year, so their thinking is this payment plan would be paid in full by the end of the calendar year. We can't speak to 2026 yet because we don't know what's coming. This is very new.
And taken out of our social security for we are to see it.
The Part B for Medicare is being taken out. Yes, that's correct. Go ahead, sir.
Is the $2,000 total drug cost or total I am popping like? There's a difference.
It's a total drug out of pocket. Deductible, what you pay, is what the insurance companies pay.
Like I have an eye injection that I get to put in the drug costs are raised by some other plan.
Uh-huh.
So, drug claim when they consider that. Would that be considered part of the weed not?
We would have to look at that and probably call in and ask because some of these things just run, and my best answer to you is it runs on Medicare math. And we don't really.
And I'm not good at math to begin with.
And when you start to do simple addition, it doesn't always add up. But it seems like you have more credit than what you've spent. So that's a positive. But again, we'd have to dig into it to really give you an honest, very correct answer. Just know it's Medicare math. It's not us not answering you. It's across the street from Baldinger's, the candy store. It's the old ESB bank building. Yes, we do. It is 527 South Main Street. It's on this brochure.
The addresses, and it's just the contact
Okay.
information. You can say our contact information.
Yeah.
Sure. But we have our cards. Oh,
Just a comment, Medicare's going to have an accounting nightmare because suppose someone's prescription, say in December, can get a $300 prescription and they only pay $100, and the other $200 has to roll over to the following year, but they want everybody to pay up.
No, it won't roll over to the following year. It needs to all be addressed in December of 2025. Paid for.
Follows $300 in December.
let's give the microphone to people.
Correct. Okay, we're going to pass the microphone around, but how are we going to answer them?
527 South Main Street, Zelienople. So when you're coming out of town going north, we're right at the top of the hill. We have a,
On the right side of the street.
going south, yes, I said that wrong. Any other questions?
Go, somebody back there
Very
had,
informal.
go, wait, this Lorna.
repeat their questions? Okay.
Is we cannot hear the comments or the concern.
Okay.
We can definitely do
Did you,
that.
do you have a question? No. Yes.
His question was, do we do house calls? Yes. You don't have to come into our office. We can come down here, whatever, wherever you'd like to meet us. Just give us a call. And everything, we're trying to help you. There's a lot of us out there. You probably get phone calls, emails, mailings, junk, a lot of stuff. And there's a lot of misinformation and a lot of true information out there right now. So we want to make sure that we're helping you get the best and help you sort through this, because it is really confusing. We've been training for it probably all summer long just to be able to keep it together. So yeah, give us a call. And there's no cost to work with us. It doesn't cost you anything out of your pocket. We get reimbursed from the companies. It doesn't matter which company you go with. It's all the same. So there's no, motive for us for you to go for one plan or the other. We just want to do what's best for you. Is there anything to add to that, Mary? We have our business cards. We're here until 3 if you want to talk to us afterwards. We just couldn't get into plan specifics because of the way that we're regulated. We have specific information we're allowed to go over in all the meetings. So,
Yeah, we're happy to schedule an appointment. We are happy to schedule an appointment with you. We have our calendars. We have cards with our phone numbers on them. Please do call our cell phones because we're not in the office a lot. This time of year, we're out. Very happy to review with you. We can come here. We can use the private meeting room that's behind the business office. I think that's, in the business office. So there's different venues. We all like coffee. I've met people at Burger King, wherever you want to meet.
Yep.
any other questions? I'm trying to think if there's anything we left out that we can finish. Although we did pass out the permission to contact forms. You don't have to fill those out, but if you wanted to and you had a specific question, you could just write it on the back. That way, we have a reference because there is so many people here, just so we remember, hey, you came to the October 4th meeting. I had a question about, one gentleman asked about his prescription, how that would work. Just write the questions down and then we can contact you and answer them or reach out to us. We're not too scary, I don't think.
Do you have anything to add?
Yeah, again, this is generic because everybody has an individual plan and individual concerns. So nobody wants to listen to everybody else's, spend their time listening to everybody else's problems with their plan. So please do schedule an appointment. It's helpful to everybody.